Okay, so for the sake of data, I will switch off my video so that we can get each other clearly. So
Okay.
in front of us is Jemima Nyandwaro. She will tell us more about herself. And Jemima, in front of you is Mr. Antina and students from Two Scarlets. I am sure they are really eager to hear from you. So Jemima, you can come out of mute, greet them, and maybe start with the first question. You tell us about yourself.
Sure. Good afternoon. I hope I am audible enough. You can hear me well?
Yes.
Okay, good. Yeah, so it's a pleasure to talk to my fellow ladies today. Thank you for the invitation, Ovin. So
They are saying they cannot see you.
Oh, you want to see me? Okay.
You
can see me now?
Yeah.
Okay. Yeah. So my name is, like Mr. Ovin said, my name is Jemima Nyandwaro. I am a medical doctor. So maybe I can tell you about myself. I graduated from medical school in 2019. And I worked, I don't know if you know Bomet County? Yes. So I worked at a hospital called Tenwek Mission Hospital. And then started my master's in tropical medicine in a school called Institute of Tropical Medicine in Belgium. So I'm currently in Belgium, and I'm doing that concurrently with something called a research fellowship. So a research fellowship is you go to a pharmaceutical company and you get to see how they make their medication. You get to see how they normally when they're trying to make a medication or vaccination, you use healthy people to see if the vaccination works before you test it on people who are sick. And you know COVID vaccines, right? Yes. So the company is called Janssen Pharmaceuticals. They're the ones one of the people who made the COVID vaccine. So that is what I'm currently doing in Belgium. So I studied at Maseno University, and medicine is, it's 6 years. And so Ovin asked me to talk more about it. So you do it in 6 years, and it's a Bachelor of Medicine and Surgery. So the first 3 years, from first year, second year, and third year, you do what is known as preclinical studies, where you do anatomy, you study the human body from the head to the toe. Then you do physiology. Physiology is more understanding the processes that happen in the human body. Yeah, how does digestion happen? How do human beings breathe? How do you sleep? Basically, the processes. Then we also did biochemistry, where you understand the molecular processes that happen up to the point where maybe energy is produced, or how excretion of different things is done in the body. And then we also did pharmacology. Pharmacology is study of drugs, yeah, just understanding how drugs are made, how the mechanism of action of different drugs. And then fourth year to sixth year, fifth year, sixth year, it's now when you go to hospital and you work with real patients, of course, under supervision from your consultants. And there you do pediatrics. Pediatrics is the study of children from birth up to 18 years old, any conditions that might affect them. Then you do internal medicine, which is understanding diseases in the adult population. Yeah. So pediatrics is for children, internal medicine is for adults. And there you see conditions like HIV and AIDS, diabetes, hypertension, kidney failure, and such. Then you also do surgery, obstetrics and gynecology, which is things to do with delivery, giving birth, cervical cancer, anything that affects women. And then you also do psychiatry, which is things to do with, mental health, right? So everything entailing mental health, both in children and in adults. And then after finishing the 6 years, there's the government of Kenya requires you to do 1 year internship, which you go to a hospital. For me, I went to Tenwek Hospital. And then, so there you rotate in all the departments that you do. So internal medicine, surgery, pediatrics, and obstetrics and gynecology. And recently they introduced psychiatry, where you go and see patients and you treat them. This is in preparation for you to be a doctor, yeah? And after the 1 year, you are now given a practicing license, and now you can practice as a medical doctor. I hope I am clear up to there.
Yes.
Then the other question that Ovin had shared with me is what inspired me to do medicine. So one is advice for my family. Yeah. So that time, I think we chose our courses when we were in Form 4. And that time we were using JAB, not the K. I'm told nowadays it's called KUCPPS or something. So we were required to choose the courses. And yeah, I had to consult my parents, just to get to understand, there's this proverb that says what an old person sees seated, a young person cannot see standing, right? So of course you have to consult your teachers and also consult your parents, and if you have older siblings. Then the second thing that motivated me is I remember I went to a school in Kiambu County called St. Anne's Leoki. And I remember just what Ovin and Mr. Atina are doing now. So we normally, we would have old girls coming to talk to us from different professions. I remember we used to have, we had teachers, we had engineers, we had nurses, doctors, we had accountants who used to come and talk to us just to shed light on what they do, yeah? And so I remember two particular ladies who are obstetricians, that is like doctors for women, yeah? And I remember being very, very, very motivated to just understanding what they did in their medical school and how they started career really motivated me to work hard, yeah? So whatever Mr. Ovin and Mr. Atina are doing is really admirable, yeah? So I think those are the two main things that I remember. And I remember the ladies telling us, once you have good grades, then you will have many, many courses to choose from, yeah? So I didn't go with one mind saying, I want to be a doctor and doctor only. I said, I have to get good grades first. And after getting the good grades, then I'll have many, many career options to choose from, yeah? So at this point, you're young, you're still not close to Form 4. So I would urge you to really work on your grades to make sure that you get good grades, so that by the time you get to Form 4, by the time you do your KCSE, you have excellent grades. Even when you're choosing the career courses, you have many options, for lack of a better word. So that is what motivated me to consider doing medicine. And then the other question was, what are the career opportunities in the medical field? So I don't know, is there any question up to there? Are we together? Mr. Atina and Mr. Ovin, maybe if there are any questions before I go on. Any clarifications?
Mr. Atina, I'm sure you could have a few questions up to that point before we go to the next question for her. Mr. Atina, you can coordinate that kindly.
No questions? I could go on.
Is Mr. Atina there? Mr. Atina, please. If there are no questions, you can do a thumbs up. I see Esther. Esther?
Oh, he's muted.
Esther, if there's a no question, you can just do a thumbs up and then we proceed.
Okay.
Okay, proceed.
Okay. So the next thing was the career opportunities. So I'd first deal with medicine. So for medicine, after you finish the 6 years and you do your internship in the 7th year, you can join residency. And by residency, I mean it's like a master in medicine, where you can do master of medicine in surgery. And in surgery, there are many options like ENT. ENT is ear, nose, and throat. You can do neurosurgery. You can do, there are very many. You can do urology. Urology is like those who deal with diseases of the kidneys and the urinary tract system. Then you can do internal medicine, you can do pediatrics, you can do obstetrics and gynecology. There's oncology. Oncology is like dealing with cancers. And you can do oncology in children or oncology in adults. Then you can also do, like for me, I like research, and especially clinical research. So I went the research way. So you can do tropical medicine, you can do public health, you can do that very medical microbiology. And microbiology is like dealing with, bacteria, yeah? Like bacteria, viruses, fungi, and such things. So I can truly say it's a whole, once you finish your degree, you have more than 1,000 things to do, yeah? Just depends with what you enjoy and what the passion that you have for that particular field. Then the other options, there's nursing. So nursing, I know you can do, and Mr. Ovin and Ms. Atina, you can correct me, if I say something wrong. So you can do a diploma that's in the Kenya Medical Training College, KMTC, and that's for 3 years, and then you work. After that, then you can also do a degree, which is Bachelor of Science in Nursing, which is offered in most universities now. And that you do for 4 years, and then you do your internship. After that, you can work as a registered nurse in Kenya. Then there's also an option of, and for Bachelor of Science in Nursing, there are many options for your masters. You can do critical care, which is, you basically become an ICU nurse. You can do emergency nursing, you can do pediatrics nursing. You see, there are very many options, yeah? Then there's an option of nutrition and dietetics. You see, a doctor or a nurse cannot do everything in the hospital, right? So you have nutritionists. When you have patients, especially in the children population or adults with chronic diseases, where you can do, where like they need advice in terms of their nutrition. So yeah, so that's nutrition. And then in nutrition, you can have pediatric nutrition, adult nutrition, renal nutrition. That is for those patients who require dialysis. They need a special diet. So there's also that. Then there's critical care nutrition. Yeah. Then after that, there's also physiotherapy. That is for patients maybe who've had an accident and they need to go through the recovery process. And in physiotherapy, there's occupational therapy, there's physical therapy, there's speech therapy. So there are very many options. Then there's laboratory medicine. And in laboratory medicine, there's microbiology, there's hematology, there's oncology. So it's a whole array. Then what other option? Radiology. So there's radiographers. And for radiographers, you have those who have specialized in CT scans, X-rays, ultrasounds. Ultrasound, yeah? So there's the ones who deal with ultrasounds are known as sonographers. I think I have almost, there's also medical engineering. In the hospital, there are very many machines that require daily maintenance, that require to be invented, like you need new machines. I remember when working in Tenwek Hospital, our department was very vibrant, that they came up with machines that would give intravenous fluids for patients without the nurse really needing to be there, like you just key in, like you need maybe 10 drops per minute or 50 drops per minute. So the medical engineers are the ones who normally come up with that. Yes. And then I think that is just a few that I can mention. Maybe if somebody has a question, you can just ask, and then I can shed light on that. And then the other thing that Mr. Oven asked me was to
Okay. Thank you very much. I think before we go to general advice,
okay,
I'm
sure.
sure there could be 1 or 2 questions, and then we can wind up with general advice.
Okay.
Mr. Tina, come out of mute and kindly. You're mute.
He's muted, yeah.
I'm muted still.
We can hear you now. You have muted. You're mute now.
We cannot hear you, Mr. Tina. Hello, he's muted here.
Mr. Tina, you're mute.
Yes. Okay. You able to hear me now?
Yes.
Yes.
Loud and clear.
Loud and clear. Thank you. So I think we have a hand here. So I'm going to give her a chance to ask a question. So probably she must come and occupy somewhere you are able to see her. Thank you. So
I am Rebecca.
Hi, Rebecca.
I wanted to ask if I study medicine in Kenya. And I want to work like in Canada. Will I must study medicine again in Canada?
Okay. That's a very good question. So each country, you can go and practice in Canada, that's for sure. But each country has its own regulations. Yeah, there's something called there's a General Medical Council that governs doctors who want to go and practice in other countries. Yeah. So for example, in the US, which should be the same as Canada, because US and Canada have the same almost medical system, you have to do some exams before you go and practice there. They're called USMLE, which is the US Medical Licensure Examination. So you have to register in their website, and then you get to see the sites that offer that exam. And some of them you have to travel to Canada or the US to do the exams. And there's a written exam and also a practical exam where you have to show there's something called medical etiquette, whether you have the medical etiquette, whether you can do the same procedures that the doctors in Canada or the US are doing. Yeah, so you have to do the exams, and you will have to travel to Canada. And then in those countries, they don't really have what is called a medical officer. So once you do the exams, you have to go to residency where you specialize in the main 4 fields that I had mentioned. Then in the UK, you have to do an English exam. After doing the English exam, they're called PLAB exams. They're also exams, which there's a step 1 and a step 2. And step 1 is mostly theory, then step 2 is practical exam. And then in Europe, where I am right now, you have to do, most of the countries are not, in Europe, they are not English speaking, yeah? So if you have to study their language. For example, where I am, you have to do Dutch. After doing Dutch, it's now when you have to do the exams, and then now you're given the license to practice in whatever European country that you want. So it's possible. I have colleagues who have done that and they're now practicing in other countries. Yeah, I hope I've answered your question, Rebecca.
Yes.
Okay,
Thank you.
Yeah, any other question? Yeah, we still have one more question here.
Okay.
Yes, please come. We have others, yeah.
Yes.
So we have quite some questions. So I hope you'll have to attend to all of them.
Okay, Mr. Tina, maybe you can let them come forward so that we can save on time.
Yeah, please come.
Just let them come forward so that when she gets the question, and then maybe Jemima, you can be as brief as.
Okay.
Okay, thank you.
Oh, hi, my name is Emily Michelle. I was asking, you talked about the medical area a lot. I was asking, where do we apply most of the physics in medicine?
Okay. Okay. So very many areas, including medical engineering. There's a lot of physics because you have to understand the mechanics of how the medical machines and the medical equipment work. Also in physiology, you remember I told you about physiology, which is one of the main courses. There's a lot of physics because in breathing, you have to understand how the volume and the pressure come out of the lungs, yeah, and how such things balance. And when you get to 4th year and 6th year, there's a lot of, in internal medicine, in understanding the respiratory system, there's a lot of physics applied there. I also did physics in high school, and I thought, when you were applying, they're only requiring biology and chemistry, which I also did. But when you go to 4th year and 6th year, there's a lot of physics that we applied. All those laws of, they're called what? The equation of forces and understanding how the mass and the volume relate. There's application of that a lot. Yeah, so you need physics. Well, you don't need physics to do medicine, but understanding the basic things in physics is important. So if you have the option of doing it, do it. Yeah.
Thank you so much. So we have another question.
Hi, my name is Abigail, and I have a question. For me, I like to do cardiologist. Can you tell me more about cardiologists?
So for you to become a cardiologist, you have to do the 6 years in medicine, then the 7th year in internship, and after that, you do either internal medicine or pediatrics. That is for 4 years. Then after the 4 years, now you do cardiology, understanding how the heart works and all the conditions that entail the heart. And that normally takes about 3 more years for you to be a cardiologist. So it's possible. You have understood?
How many years in
Okay. So 6
How
years
many
in
years?
medicine. Yeah, so 6 years in medicine, then 7 plus internship, then 4 years in internal medicine. So that's 11. After that, you have to do fellowship, which is about 3 to 4 years. So maybe 15 years. Yeah.
Thank you so much. Yeah, the next question is coming shortly.
Hi, my name is Linda. I want to be a nurse. Which grade should I get so that I can study nurse?
I'm sorry, I didn't hear well. Please come up again.
Okay, I want to be a nurse.
Nice.
My question is,
yeah,
which grade should I get so that I can study nursing?
Okay. That's a good career choice for you to do nursing. I know at least you have to have maybe an A- and above for you to do degree in nursing. And then for Mr. Atina, please correct me, and Mr. Ovin, I'm not sure about the diploma stage, but I think at least a B- and above But then again, like I said, be open-minded. The world is your oyster. Once you get good grades, you will have very many options to choose from. Cindy,
Yes, thank you. Yeah, one more question here.
Okay, we can have the last question and then we can proceed to general advice. Because I'm sure Mr. Tina's battery could be running low.
Okay. We lost him.
Okay. Hi.
Hello.
Hi.
Probably.
My name is Faith, and for me, I want to be a pediatrician, and I've not heard you talking about that career. It's part of doctor.
Okay.
Hello. My name is Faith, and I want to be a pediatrician, and I've not heard you talking about that career.
Okay. Okay. I think I did. Maybe I did it so quickly. So for pediatrician, that's doctor who deals with children, yeah? And for that, you actually do pediatrics, but just a little bit in your 4th year and 6th year. And then for you to be a pediatrician, you go to do a Masters of Medicine in Pediatrics for 4 years.
One last question, please.
No problem.
Hi, my name is Abigail, and I had a question. Now, let's say I'm going to go on the field exam for 4. Then when I reach university, and I learn about physics. Let's say it's engineering. Then afterwards, I'm going to come back and maybe study medicine. Is it possible? Do maybe 2 careers.
I think that's a lot. And Mr. Tina, it's possible.
Yes.
I know several people who finished their degree in medicine and went to do law and other engineering. So, like I say, the world is your oyster. You can do anything that conceives you in your mind, you can do it.
So, do you advise for that?
Mr. Owen and Mr. Tina, would you advise?
Okay.
Medicine. I would like to hear your thoughts. Owen, Mr. Tina.
Okay, for me, I didn't get her question. I think the network on my end is crumpled up.
She wants to do medicine.
She wants to do what?
Engineering. She wants to do medicine. But very, very smart.
Yeah, actually, her dreams are valid. Abigail, just like
Yes.
Jemima has told us, the world is your oyster. Whatever it is that you conceive in your mind, and you have the determination, you know, anything is possible, Abigail.
Yes. Okay, thank you. Then there's this question. Let's say you're performing right now. You are performing maybe D. How can you advise us to come back or bounce back into our grade?
Sorry, I didn't see you. Please come up again.
I'm saying maybe you are performing great in Form 1, but right now you're a poor performer. You're finding yourself at the bottom of the league. How can you advise us to come back the comeback?
Okay. So first, I would advise you, what are those subjects that are pulling you down? Yeah. If maybe you're seeing sciences or the humanities, you're not doing well in them, maybe you need to focus on them and dedicate more time for those subjects. If possible, I know your teachers are very, very approachable, or even your friends, the friends that you have in school. So go back to the drawing board, understand, okay, so is it math? Is it chemistry? Is it biology? What is really bringing my grade down? Then once you identify them, then you need to put extra hours maybe during break time or during lunch break, you say, oh, maybe it's math. Okay, so I need to do maybe 1 or 2 sums, 1 or 2 like problems before we start classes at 2 p.m. Yeah, and I think practice and repetition, things will eventually work out, and I'm sure having that positive attitude that you have identified, oh, okay, so I don't like my grade. Okay, so that's the first step. What next? What do I need to do for me to move from point A to point B? Maybe talk to my teachers, talk to my friends. I need to put extra hours. I need to avoid people that maybe derail me from achieving that particular goal. Yeah. And maybe even doing extra, we had those books that had questions, maybe going through questions every day, going through understanding, okay, so it's math, and maybe I don't like this particular topic, then I know I need to put extra time to work on that.
Okay, thank you.
Very much. I think we can now go to general advice, because I'm sure the matrix will.
Yeah.
So, yeah, you have told us so many things, and one of the take home for me is, let's get the good grades first. We get the grade, and then the opportunities on our table, on our desk, will be limitless. So give us general advice, Jemima.
Actually, don't have...
Sorry, Dr. Jemima.
No problem. So for me, I think the main thing that I would encourage you ladies is, the first thing is commit your ways. I am a Christian, and I believe God has good plans for us, yeah? And I like this verse. It's one of my favorite verses, Proverbs chapter 16, verse 1. Commit to the Lord whatever you do, and he will establish your plans. So you may have plan from A to Z, many plans, things that actually make sense in your head. But if God is not in it, then I think you're headed in the wrong direction. So that would be the first thing. Then the second thing is understanding your strengths and weaknesses. Like what Abigail said, if maybe you don't like the grade that you had maybe last term, it's okay. So you need to understand, okay, so how do I move from point A to point B? And what are the resources available for me to move from this point to this point? And I'm sure now with your teachers who are organizing these talks for you, they're definitely people who have good plans for you, yeah? People who have good intentions for you. So approaching them and involving them in improving your grades is really important. Then the other thing is, just to reiterate what Ovin said, yeah? Be open-minded. Once you get those good grades, the world is your oyster. You can do whatever you want to do, from engineering to piloting to anything that you want to do. And I told, there's this thing, I remember when I was in high school, you'd feel bad because maybe you didn't manage maybe to go to the big schools. Yeah, our time back then, I was in high school in the 2000s. We were saying, if you don't go to Alliance or this big Kenya high school, then you won't be able to do medicine. But I went to a very, very small school right in the middle of Kiambu County. We were actually surrounded by coffee plantations that even people were talking about sneaking. You're like, you cannot sneak out of this place. Yeah. So whatever you conceive in your mind, knowing that this is what I want to achieve, does not matter. You went to Alliance, or you went to the day school right next to your home. Whatever you put your mind to achieve, you can achieve it. Thank you so much for having me.
Thank you very much. I think we really can't get the right words to express our gratitude. I can see the smiles on their faces. Maybe Mr. Tina can say better. Mr. Tina.
Yeah. Yes, thank you. Yeah, I want to appreciate Daktari for her time and talking to us. I actually never knew about this thing. Why it's not for Mr. Obin, who just informed me that, I have to be part of this and assist her learners his learners get access to Daktari. So by just being used, then I've learned quite a lot. I really appreciate for that. And may God bless you.
Thank you
Thank
so
you.
much.
Maybe we can also have, I see Celestine there. Celestine, you can say something. You can give vote of thanks. And that's Celestine I see on the screen.
Okay, my name is Celestine. I've really learned a lot. I've also, let me say I've learned a lot because I wanted to be a biomedical engineer, and I think you've talked about that one. So we all say thank you. We have all been influenced, and we will work hard, and we will set our minds. Thank you.
Thank you so much.
Thank you very much. Once again, I think